All right. Well, thank you for tuning in today to the Navigating the Coronavirus Economy series. I believe we're on part 16 already. It's amazing. And we have invited a guest to join us today that is is a legal expert. He's a lawyer and someone who brings a lot of years of experience in his field of practice. But what really caught my eye is I've been following him for several years now on social media and on his email distribution list. And there was a topic that came up here recently that he was talking about, this whole idea of a bill that is in the Georgia state, Congress, that is talking about potential protections for businesses from potential lawsuits or issues that might come up along the way. And through this, because due to the coronavirus situation and the COVID-19 situation that we're all in. And so I have asked Rich Valladares, who is the chair of litigation at Greenberg Traurig, to join us today. And for those of you that are not familiar with Greenberg Traurig, it is a very large law firm with about 40 offices in 11 countries all over the world, with specializations in, I think, just about everything you could think of. And I know from a franchise standpoint, they're very present in the franchise community, sponsoring events, and have a nice franchise practice as well. And so with that being said, Rich, I'd like to turn things over to you to make an introduction, and then let's get into the conversation here about this potential liability and laws and bills and things that are going on.
Great, thank you. Thank you very much, Tom, for inviting me. I also follow you, and I find these to be really informative. I do appreciate you following our notices and alerts that go out from Greenberg Traurig. Greenberg Traurig, like you said, is an international office. I'm the chair of business litigation in the Atlanta office, and so I've been there for a little over 15 years. Prior to that, I practiced for about 5 years in the New York, New Jersey area, also in litigation. And so I want to thank you for having me. I look forward to speaking with you all today. I may not have all the answers to all the questions because this is definitely a new area of law for every firm, but I'm happy to be here.
Great. Well, thank you. Thank you so much. And I know that that as we get into this, one of the things that kind of caught my eye was this bill or law. I don't know if you could maybe speak to that, of what's going on in Georgia, and then talk about how that maybe what's going on federally and in what you're starting to see in other states around the country as well.
Absolutely. And before I begin, let me give my disclaimers, because we're going to be talking a lot today probably about disclaimers. But this is just for general information purposes, what I'll be speaking about today. You know, to the extent a client has a specific issue in a specific business, we need to look at those facts and circumstances. So I just want to make sure nobody runs out and does anything without consulting with their lawyers, et cetera. But let's get back to the Georgia Senate Bill 359. So we sent out an alert recently about Georgia Senate Bill 359 because a lot of businesses were unaware of the potential liability protections that it offered to Georgia businesses. And what it is it's a bill that's currently pending that, if enacted, it would protect both healthcare providers and other entities and businesses from liability related from COVID-19 infections or transmissions. And that would be a negligence protection. It would not protect, and I haven't seen any bill out there, either in other states or in the federal government, that protects against gross negligence, wanton misconduct, recklessness, etc. But it would give you a negligence protection, and those protections are good because they would give you a layer of protection against those kind of low-hanging fruit lawsuits that plaintiffs' lawyers look at. They'd much rather sue an entity that doesn't have a liability protection in place. And so what the Georgia Senate has proposed to do is offer businesses some level of comfort as they go to reopen in this new pandemic era that we're in. That if they do open and do certain things under the law, they will have at least a response to any negligence lawsuit that's filed against them by employees, customers, et cetera, who might get an infection from COVID-19.
Interesting. So, Rich, just a question for you about that. One of the things I'm wondering about is, and I'm sure many of our small businesses or even the big businesses tuning in, if you're a general manager or someone that's managing staff or employees at a location that's dealing with this. So I guess, can you speak to the idea that you mentioned gross negligence and can you give us an idea about these guidelines or general requirements that, someone should be aware of, or just in general, that some maybe I don't know if it's a best practice, but just some ideas for a business to be thinking about?
Sure. And let me go back to the Senate bill when we're talking about this to
Great.
bring it into context. The Senate bill, the reason I sent the alert out is not just to inform businesses that they should be supporting that bill because it provides a layer of protection, but specifically in this bill, it gives guidelines and directives about the warnings you're to post in your establishment or business in order to have that protection kick in. And those protections and the warnings that are associated with them have specific requirements about how large the sign is, the font size, where it's posted, et cetera, specific language, where it is on a receipt upon entry. Unless you do those specific things in detail, you wouldn't get the protection of Senate Bill 359. So there's a few reasons why I posted it. One, businesses should be writing to support this bill because it'll provide them some protection. Two, they should be well aware that once that bill comes into effect, what they need to do specifically, not generally, to make sure that they get the protections of the bill once it's invoked. And then three, if I were a business owner and I was open now, I would be abiding by those principles while I'm open, because if a lawsuit is filed, I think you're under much better footing if you provided the warnings that the government is currently recommending, even if not passed, to warn its customers of potential COVID-19 infections or risks, et cetera. And so when you're talking about negligence versus gross negligence, typically negligence is what would a reasonable person do in a similar situation. And gross negligence is what would an inattentive person do in the same situation. And so you need to make sure that you're at least meeting this kind of bare minimum of, I'm not negligent because I'm doing what I'm told to do. Gross negligence could mean something where you should have done more, you weren't acting even in close to what a reasonable person would act to. So it's more of like a recklessness standard under the law. Does that help?
It does. Yeah, that's very, very helpful. And so, Rich, to your point, and we were talking about this before we went live here this afternoon on this, but one of the things that you had suggested is to, especially for business owners that, you're kind of getting over this hurdle of the whole pandemic and shutdown and the whole crisis that's going on there. And now this concern of potential looming liability or lawsuits that are hanging out there. And so you had suggested, and you mentioned it briefly here, make sure you're notifying your representatives, your local state representatives and your federal representatives about these bills and laws that are coming up for decision. Make sure you're telling them to vote in support of this. So maybe speak to that a little bit.
Sure, absolutely. The alert I sent out that you saw was the Senate Bill 359 in Georgia. What most people aren't following is there's also some federal bills that are out there that are being proposed, which would offer similar protections. In fact, just a few days ago, about 21 governors and the U.S. Chamber of Commerce wrote letters to the senators, et cetera, asking them to pass these COVID-19 liability protection bills in order to give businesses that layer of protection on a blanket federal layer across all states. You should know that there is a significant amount of plaintiffs' lawyers, tort lawyer associations, et cetera, that have moved against the bill, as well as some other organizations. They've said that if you provide businesses with this layer of protection, it will decrease consumer confidence that businesses are doing what they need to do, and so consumers won't enter into businesses as freely as they would if they knew they can sue you if something went wrong. And that's why I think it's important for businesses to be just as active as the plaintiffs bar when these proposed legislations are on the table, especially as new laws are currently being passed to provide some relief to the citizens for this next phase. And as part of the relief package, that's where this liability protection is. So it's important for everybody to review it, follow where their state is, and to write their House of Representatives, their Senate representative, to make sure that they're supporting these bills.
Great. Well, thank you for that. And I wonder, as you know, do you have any suggestions from for a business that's thinking about this? Like in my, you know, we have a customer base that's spread out across the country. So, what are some just general ways someone could maybe find out about this, or what's going on in their own state? Do you have any general suggestions on that?
Sure. So I will give you the name of the act in Georgia so that you can follow it there. That is the COVID-19 Pandemic Safety Act, and it's Senate Bill 359. That's publicly available. So if you go online, you can pull that down, look at the act, and read the language, and then write your local representative. On the federal bills, that's also public knowledge. So if you look up the 21 governor's letter that just went out, that pops up quickly on Google. You can find the act, the proposed legislation, and who you should write to there as well. But you know, whatever you do on that side, you should also be, more importantly, is as your business goes to reopen now, and we're switching from phase 1 to phase 2, back to phase 1, et cetera, in multiple states, that gets really confusing. What you should do is visit your state representatives' legislations that are on the table as well. Look at what they're requiring to get that liability protection, and make sure that at the very minimum, you're doing what's required under the bill to get that protection in each state that you're operating.
Well, that's a great point. And I think what I'm hearing come through consistently, Rich, as you're talking about this, is as a business, as an owner, as the leader of your organization, you should be taking proactive steps to be at minimum implementing guidelines or that have been either stated or proposed by your state legislators, or just implementing some, if there isn't anything like that in your state, just working with something like we had talked previously on other episodes of our webinar series about the U.S. Chamber of Commerce having guidelines and the International Franchise Association having guidelines. Some of these large associations having some best practices or recommendations. Could you maybe speak to that a little bit?
Sure, and I think that's where this landscape is so precarious, is we currently have not a consistent message from governments or directives as to what to do in order to provide a safe environment. And so you'll see even locally here in Atlanta, we have issues with the mayor and the governor and different directives that are coming out, and a push and pull. That leaves businesses in this very weird zone when you're dealing with an unprecedented pandemic that we haven't dealt with the likes of which in this century before. And so the law is, and so I can sit here and say I know where the liability is going to come, but I assure you no one does, because the law is very undeveloped in tort and contract law when it comes to a pandemic of this scale. And so you're going to see really creative theories about what you should or should not have done during a specific period of time. And then you have different responsibilities to your workers that you do to your customers and your employees, et cetera. So the best thing to do is really to look at all the directives as much as possible. Some of these bills, as the language has been written, for example, Louisiana, I've seen their proposed bill says, yes, there are competing directives, but you should be following one set of directives. So it actually acknowledges the fact that businesses are receiving confusing messages from different governments, but says you should be following at least one of them, right? And so you need to really look at this. This is why it was so important for me to put out the alert. You need to look at the specific language of the bills in your state to understand what the scope of your responsibilities are. And then, you know, with respect to the federal versus the state, one thing I left out is it's not enough to just support the state bill, because, for example, the Georgia bill would go into effect in August, and then the liability protection would only last until July 2021, and then it would expire. With the federal bill, it provides retroactive protection that the state bill doesn't appear to provide. And so the federal bill would say, well, anything you did back when this pandemic started all the way through the end of the Emergency Act, which is probably in 2021 or 2024, you would be protected from liability. So there's differences in the federal and state law that these businesses need to be aware of. And that's why you need to throw your support in all directions, not just in your local or state level, but also on the federal level. And then what can you do? I could tell you that there are lawyers in my office that have prepared laundry lists of what you can do, because the fact of the matter is there's no simple answer. There have been lawsuits that have been filed in this state now, from customers to businesses, from patients to medical facilities. And in each of those, you have different competing interests and different standards. So for example, at certain times in these lawsuits, for example, in Missouri, I know that there was a meat processing plant where some of the employees sued. That lawsuit was kicked to OSHA to determine whether or not the safety standards in the workplace were met for COVID-19. And so the OSHA standards kicked in. And then when it comes to customers, you talk about warnings and did you provide a clean environment, et cetera. And sometimes you talk about employees and what duty do you have to notify other employees if one employee gets COVID-19? And did you violate the HIPAA laws by revealing who got COVID-19 in your business? And so I can't stress enough that right now, and this is the most unfortunate place for a business to be in, I think, is that you went from being shut down and dealing with the economic impact of that shutdown to now being told you could open without clear directives and an area of law that's undeveloped. And so you can't really look to precedent. And so when you have that layer of risk that seems substantial, you need to try to invoke as many protections as you can. And that's why I'm starting with the bare minimum, which are the government directives. And then you should go even more so into what am I doing in my specific business? Have I updated my employee handbook? Am I making sure I'm providing tests when necessary if there's an outbreak? Am I making sure we're doing deep cleaning if there is an employee that has shown symptoms or signs or been tested positive of COVID-19? So it's just a plethora of laws and regulations that are out there. And what I would like to do, at least now, is highlight for you all the legislation, what you need to do there with the warnings. You should take a look at that, support your layer of protection. And then to the extent you have outbreaks, you've got to make sure that you're dealing with them in the most protective manner because of the undeveloped area of the law that we're dealing with.
Wow. That is, I mean, great information, really great recommendation and information there. And so I guess I'm thinking of this from, you mentioned it's interesting to think about as a healthcare provider or people who are on the front lines, these caregivers. I'm thinking about home health or
Yes.
personal caregivers. You've got all the way to doctors and nurses and hospitals and urgent cares and centers like that. But I'm thinking about how that. And I don't know if you can talk to this, but I'm thinking about a business where you are going into someone else's home. For example, maybe a cleaning service or these home care services that have kind of still been operating, and now you're going into somebody else's home. Can you talk a little bit about that?
Sure. And there was one lawsuit, for example, that's been filed in Georgia against it's a Southwest healthcare facility, long-term healthcare facility. And in the complaint, one of the families alleges that their family member who caught COVID-19 in the facility was exposed to undue risk. And as part of the facts alleged in that complaint, they saw an employee from the facility walking into the facility who had forgotten their masks. And when they asked them about the mask, they said that they were in the car and continued to go in the facility. So it gets down to that kind of layer of what your employees are doing with respect to exposure of someone out in the public. So if your person's walking into a home and you're not doing some kind of testing or offering some kind of protections, who knows who can sue you from that home if they're exposed to the virus because your employee had the virus and was asymptomatic, et cetera. But then on top of that, the business has a twofold, because if the employee is not given adequate protective measures to go into that home, are you being provided with a handbook of what to do and not to do? Are you being provided with protective equipment to go in? Are you being provided with tests when necessary? And are you getting leave if you're not feeling well? All of these types of things expose you not just to that employee, but to the rest of your employees who they may infect when they come in. And so it's really precarious, and that's why the more protections you can put in place and be on top of the developments in this area, the better it is. But you definitely need to take affirmative action to protect both the employees and the public, whether that be a warning or protective equipment. It all depends on the specific circumstances and nature of your business.
Oh, that's really helpful. Thank you. Thank you. Yeah, I think it's just when you start thinking about the just the complexity and how quickly it starts spiraling, and you see every little turn and every little corner and crack, and just there's so many potential what appear to be potential maybe landmines along the way for someone or for a business owner to be thinking about. So, as they're just thinking about it, as you're trying to save your business and kind of keep it alive just by having revenue coming in and keeping customers coming in, now you have this additional complexity that really, maybe if you're in the healthcare space, you have had some experience in working in these kinds of environments, maybe to a certain extent in the food business because there are food handling restrictions and requirements. But for a lot of other industries and businesses, this is foreign. This is new, even especially for even an office type setting, a professional services type business, So I guess maybe let's speak to that for a moment, if you wouldn't mind, taking away, kind of went to a retail side, going to the customer. Now, let's say you're just, it's a law firm or a professional services provider, or you just have an office, a marketing organization. I don't know if there are any recommendations you would suggest or anything that you could talk through about from that type of a business.
Sure, there are, and it really goes to the protections that you're providing to your employees. And where do those protections come from? It comes from all different areas. It comes from government directives. It comes from health and human services. And you can look at how to establish business best practices. Do you have one-way lanes in your hallways? Are you allowing kind of density requirements so that you don't have 6 people working on top of each other in a conference room? Are you allowing people sick leave when they're exhibiting symptoms and don't want to come in for that day or week or whatever? And so it doesn't really matter that's the problem here. It doesn't matter what your business is. The exposure is there. And it really is higher with what I've seen, at least from the uptick in cases, it's higher right now with respect to employees because you haven't seen many cases of customers coming in. That's due to the fact that I believe it's hard to trace. The contact tracing doesn't allow the causation element of customers to say, I definitely caught it in your business. That causation trace, though, is not as difficult when you're dealing with whether an employer provided an employee with the protections necessary to work in a safe environment. And I think that's why you're seeing more of these OSHA type lawsuits from the employees. And you really need to, at this point, have, your HR department really needs to have protections in place and updated manuals and notification and specific processes they can point to show that the business considered this on the front end and wasn't grossly negligent in just pushing it back into the same workplace it had prior to COVID-19.
Great. That's great advice. Great suggestion here. Thank you for that. And I don't know, Rich, are there other points you'd like to make sure we talk through before we maybe open it up, see if anyone has some additional questions for us?
No, the only other thing I'll mention is that we talked a lot about tort liability.
Yes.
But the other area that this exposes is contract liability. And I'm sure a lot of the businesses are dealing with suppliers that can't supply, and does the force majeure clause get you out of that issue? And we're seeing the law starting to get developed in different areas in that regard as well. And so with respect to contract liability, my only recommendation is, one thing I've seen is in some of the cases, businesses are immediately sending out force majeure notices of, we can't perform because of an act of God. Well, what that has flipped on some businesses is that the other side then says, if you don't prevail on that, you've repudiated the contract, and so I immediately get damages from you. And force majeure area is not as developed. That was a risk that I think was unforeseen by shooting those notices out, only to get a counterclaim back and actually lose in court. So I would just say, as you're considering force majeure clauses or other things in your contract, impossibility, impracticability, frustration of purpose, or something like that due to the pandemic, that before you shoot out a notice, you just consider what could be whipped back at you when you're dealing with this undeveloped area of the law as well.
Interesting. Interesting. That's a great point. Really, really good. Well, while we have Rich here with us, any questions from anyone that's on the line that might have a specific question related to their business, or just in general for while we have him here? And I don't know if I saw any chats come through the chat room here. Well, great. Well, if you do, as we're kind of closing out here, Rich, how if someone wanted to get in touch with you to seek your counsel or further, maybe a one-to-one consultation to kind of get this going, what's the best way for someone to reach out to you to talk further, maybe about their specific needs that they might have?
Absolutely. First thing, go to our website. It's www.gtlaw.com. Or you could email me at valladaresr@gtlaw.com, and that's V as in Victor, ALLADARESR@gtlaw.com. We have offices pretty much in every state, so if you have local needs somewhere else, you can still call there and we'll hook you up with whatever you need from that state. And again, it's nothing for consultation. So if you just need to determine whether we are the right ones or whether we can refer somebody out, just please feel free to call.
Great. Great. Well, thank you so much for being here. I really appreciate your time. And thank you all for tuning in on, oh, wait, we had a question pop up. So the question is, so I guess the question says, so I guess a lot of whether people are opening or not depends on the comfort level of the owners. So I guess that's a good point. So Brian, I think what you're saying is maybe as an owner is maybe considering opening, or maybe your state or your area has kind of, as you mentioned, Rich, gone from phase 2 back to phase 1, or whatever, kind of doing this back step. I guess, do you have any comment or on that question?
Yes, I think yes, most businesses are opening when they have a comfort level that they can afford to open, and that some of that is putting these protections in place, right? Because if, for example, if you're a restaurant, we've seen a lot of insurance cases where the restaurant owner is saying, if there's a government directive that I remove half of my restaurant space as closed, that there is property damage to my restaurant, so I should get coverage so that I can continue to operate at half capacity. There are other businesses that open or don't open because of whether or not they have the ability to put these protections in place. And some of the protections are, can you administer social distancing? Can you have face coverings, hand washing breaks, paid leave for sick employees, et cetera. So I think there are a ton of considerations that go into whether you're comfortable or not. Some of those financials, some of them exposure to liability, because even if you're not exposed to a case, you need to have the funds in order to put in these protections, update your handbook, et cetera. The one thing I will say, though, is it's best, and this is very confusing in this era of different governmental directives, governor, mayor, city mayors, et cetera, who may disagree, because you need to follow the government directives in order to avoid those liabilities. To the extent a plaintiff's lawyer can make an argument that you should have been closed when you were open, that's a much harder case, I think, as we go down the road. Again, it's undeveloped, and I know it's really confusing, and it requires an analysis of the government directives in place. but it's a consideration.
Great. Thank you. Thank you. Great. Well, Rich, I really appreciate you being here. Thank you very much. We will get the this on a replay for a rebroadcast, and we'll make sure we include your contact information so that it's easy for people to get in touch with you or reach out to your and get access to the company website and to reach out to you if needed. So thank you very much for being here.
Great. Thank you very much, Tom. I really appreciate it.
All right. Thank you.
Have a great day.